Hello and namaste everyone. Today we are going to talk about the anatomy of the posterior cranial fossa. The posterior cranial fossa is the largest and deepest cranial fossa formed by the occipital bone and parts of temporal and sphenoid bones. It contains the brainstem and the cerebellum. Dorsum sellae of sphenoid, not clearly seen in this specimen, is present anteriorly towards the center. Clivus, which forms the anterior sloping wall of posterior cranial fossa, is formed by the fusion of part of body of sphenoid, that is basis sphenoid, and basilar part of occipital bone, that is basi-occiput. The pons and medulla rest on the clivus. The squamous part of the occipital bone is present posteriorly, while the petrous and mastoid parts of temporal bone form the lateral boundary of the posterior cranial fossa. The fossa is bounded on the anterolateral aspect by the upper border of the petrous part of temporal bone. Posteriorly, at the same horizontal level, we encounter a sulcus known as transverse sulcus. The transverse sulcus is responsible for lodging one of the dural venous sinus, that is transverse sinus. The roof of posterior cranial fossa is formed by a dural fold known as tentorium cerebelli, which in Latin means tent of the cerebellum. It is attached to the internal occipital protuberance and the margins of the transverse sulcus on the posterior aspect at the level of external occipital protuberance and superior nuchal lines present on the external aspect of the occipital bone. Anterior margin of the tentorium cerebelli is attached to the anterior clinoid process, and its lateral margin is attached to the posterior clinoid process and superior border of petrous temporal bone. The tentorium cerebelli, that was the roof of posterior cranial fossa, divides the cranial cavity into supratentorial and infratentorial compartments. The posterior cranial fossa communicates with supratentorial compartment by means of a tentorial notch present on its anterior aspect. It communicates with the vertebral canal through foramen magnum. Key features of this fossa include the obviously visible foramen magnum, internal acoustic meatus, jugular foramen, hypoglossal canal, internal occipital protuberance, and transverse sulcus. The tentorium cerebelli protects the cerebellum and the infratentorial brainstem from pressure of heavier upper part of the cerebrum. The most conspicuous feature of the posterior cranial fossa is the foramen magnum, which in Latin means great hole. It is the largest opening of the skull and is present in the basilar part of the occipital bone. This foramen is responsible for connecting the posterior cranial fossa to the vertebral canal. It is an important feature of bipedal mammals. The basi-occiput is present on the anterior aspect of the foramen magnum. The alar ligament, which joins the dens of axis to the tubercle on medial aspect of the occipital condyle, is responsible for creation of two compartments within the foramen magnum, which are the anterior smaller osteoligamentous compartment and the posterior larger neurovascular compartment. Structure passing through anterior compartment are the tectorial membrane of atlantoaxial joint, the upper band of cruciate ligament to atlas, alar ligament, and the tip of dens. Similarly, structures passing through posterior compartment are the inferior aspect of medulla oblongata, its meningeal coverings, spinal accessory nerve, vertebral arteries, anterior and posterior spinal arteries, and sometimes cerebellar tonsil. The internal acoustic meatus present at the posteromedial aspect of the petrous temporal bone is a small bony canal about 1 centimeter long which connects the neurovascular structures from posterior cranial fossa to internal ear that is present in the petrous temporal bone. This meatus is responsible for transmitting cranial nerve 7, cranial nerve 8, and labyrinthine artery. The lateral end of the internal acoustic meatus is known as the fundus. A shallow fossa known as subarcuate fossa lies lateral to the internal acoustic meatus against which the flocculus of cerebellum lies. Further laterally, on the posterior surface of the petrous temporal bone is the orifice of aqueduct of vestibule. The jugular foramen is bounded anteriorly and superiorly by petrous part of temporal bone and posteriorly by the jugular process of occipital bone. The superior margin of jugular foramen, formed by sharp inferior edge of petrous temporal bone, has a notch for inferior ganglion of cranial nerve 9. The anterior part of the foramen transmits inferior petrosal sinus. The middle part transmits cranial nerve 9, 10, and 11. This can be remembered by highlighting the initial letter J of jugular foramen, which is the 10th letter of English alphabet. So now it becomes easy to memorize that 10th cranial nerve and its adjacent nerves pass through this foramen. And the posterior part of the jugular foramen transmits the continuation of sigmoid sinus, which is now called the internal jugular vein. Due to various lesions such as thrombosis of internal jugular vein, meningioma or neurofibroma, which affect jugular foramen, a syndrome known as Vernet syndrome, which is also known as jugular foramen syndrome, may arise, which is characterized by paralysis of cranial nerve 9, leading to loss of gag reflex and dysphagia, paralysis of cranial nerve 10, leading to hoarseness of voice and dysphagia, and paralysis of cranial nerve 11, which leads to weakness in shrugging of shoulder and turning the head. Hypoglossal canal, also known as the anterior condyle canal, transmits cranial nerve 12, which is present on each side above the anterior part of lateral margin of foramen magnum. The lateral aspect of the sloping clivus is separated from the petrous temporal bone by a fissure, which lodges inferior petrosal sinus that runs inferiorly towards the jugular foramen to end at the superior bulb of inferior jugular vein. The clivus is related to the basilar artery and basilar plexus of veins too. On the posterior midline aspect, we can encounter an elevated crest known as internal occipital crest. It serves as an attachment site for falx cerebelli, one of the dural fold that is present between the two lobes of cerebellum. At the lower end of this crest, a Wormian fossa is present, which is in contact with the inferior vermis of the cerebellum. The upper end of the internal occipital crest is called the internal occipital protuberance. This protuberance is the point of meeting of three dural folds that are falx cerebri, falx cerebelli, and tentorium cerebelli. It is also the meeting point of dural venous sinuses like superior sagittal sinus, the straight sinus, and occipital sinus. Dural venous sinuses are the veins that drain blood from the brain. This meeting point is known as confluence of sinuses, sometimes also known as torcular hierophyllae. At the internal occipital protuberance, the superior sagittal sinus turns to one side, usually right, into transverse sulcus. The other side of the transverse sulcus, usually the left, also begins at the internal occipital protuberance by the inflow of straight sinus. The internal occipital protuberance is indicated on the outer surface by external occipital protuberance. Above the internal occipital protuberance, which is to say above posterior cranial fossa, is the groove for superior sagittal sinus. The transverse sulcus extends laterally from internal occipital protuberance and finally ends at the sigmoid sulcus. The transverse sulcus and the sigmoid sulcus lodge the transverse sinus and the sigmoid sinus respectively. The squamous part of the occipital bone present on either side of the foramen magnum is in contact with the cerebellum below the transverse sulcus and with the occipital lobe of cerebrum above the transverse sulcus. The sigmoid sulcus that lodges the sigmoid sinus ultimately leads to the jugular foramen. An inadequately developed posterior cranial fossa may cause Arnold-Chiari malformation where there is inferior dislodgement of the cerebellar tonsils through the foramen magnum. Posterior cranial fossa tumor may be encountered in this area. In adults, these tumors include ependymoma, cerebellar metastasis, hemangioblastoma, schwannoma, meningioma, etc. We should also remember that an important space occupying lesion is that of a subacute stroke, which can mimic a tumor. Posterior cranial fossa tumor encountered in children include medulloblastoma, pilocytic astrocytoma, brainstem glioma, ependymoma, etc. So, this was the brief description of the posterior cranial fossa. Thank you for watching.